and welcome to Afternoon Briefing here on ABC News. I'm Patricia Karvelas. Coming up, National Cabinet given an update on the progress of the coronavirus vaccine, with the PM urging any country that cracks the code to share it with the world. But first, here are today's top stories. More people to be eligible for JobKeeper as the government eases the rules for the wage subsidy scheme. Victoria records another 450 COVID-19 cases, with 11 more people dying from the virus. And ATARs, along with VCE results, to be adjusted for Victorian Year 12 students because of the state's lockdowns. Victoria has recorded 450 new cases of coronavirus since yesterday. Another 11 people have died in the state, 7 are linked to aged care, bringing the state's death toll to 181. The combined Australian Defence Force and Department of Health workers conducted more than 1,000 door knocks yesterday to ensure Victorians who should be isolating are doing so. Premier Daniel Andrews says 150 of those were not home.
There is a trend here. There are some people who are not taking their ISO seriously, but I've got to say, out of 1,150 visits that were conducted yesterday, the biggest day ever, we only had 150 of those people who didn't answer the door. That's less than some of the numbers, up to a third, that had been running earlier. So that's a wholly good thing. Of those 150, there will be a percentage who are not doing the right thing. Then there'll be a much larger group, I hope, that'll be able to convince police that they had a reason, a perfectly good reason, not to have answered the door when ADF and Health Department officials knocked on it.
Over in New South Wales, a Newcastle high school is closed for deep cleaning today after a student tested positive to COVID-19. Reporter Madeline Lewis has more from outside St Francis Xavier's College.
The latest case in the Hunter is the third in a family cluster here in Newcastle. A male teenager who is a household contact of another teenager and a man in his 20s who were identified COVID-19 cases yesterday. Now, this latest case has led to the closure of St Francis Xavier's College here in Hamilton. Now, cleaners have arrived, about 4 vans, at least 20 cleaners. They're all suited up from head to toe. They've got masks on, glasses on, carrying mops, buckets and lots of chemicals to start that deep clean process. They've scattered around the school ground to begin that process. Contact tracing is also underway. Anyone who was at the school on Monday, Tuesday or Wednesday this week is being urged to be on the lookout for COVID symptoms and to get tested immediately if any arise. However, those that are close contacts of this teenager will be made to go into isolation for 14 days regardless of their test result. Now, this is the second Catholic high school to be closed this week due to COVID-19. Yesterday, St Pius at Adamstown was closed. It remains closed today, and that's due to the teenager that was identified yesterday. This person has now notched up about 140 close contacts who are now in isolation. That's because this person is linked to a bus ride and also a soccer match that happened in Sydney on the weekend. Now, the man in his 20s, the other person in this cluster, is now linked to about 7 venues in Newcastle, and that includes Hunter Stadium. Now, the concern with this cluster is that the source of infection is still unknown, so authorities are working around the clock to try and figure out where it came from. Another concern is that these 2 schools that are closed, they've got quite large student bodies. At St Pius, over 1,000 students, years 7 to 10. Here at SFX, they've got over 900 students, and that's just year 11 and 12. So quite an opportunity for this virus to spread. And also, these year 12 students are preparing for their HSC trials that are meant to start in the next 2 weeks. So there's cause for concern on how they might be impacted. But the Catholic Schools Office of the Maitland Newcastle Diocese is reassuring those year 12 students that their HSC will not be compromised because of what is happening here today. It's unclear when this school will be able to open again. It's hopeful that St Pius might be able to open on Monday.
Queensland's state tally of coronavirus cases has gone down by 1 after the state reclassified a false positive test. No new cases of coronavirus were found overnight. It comes as the state prepares to enforce a hard southern border with New South Wales, the ACT and Victoria tomorrow. The Deputy Premier Stephen Miles says information is available online for Queenslanders who want to return home before it's too late.
These new, tough border restrictions are all about keeping Queensland and Queenslanders safe. They are all about keeping the virus out of Queensland, protecting the lives of Queenslanders so that we can continue with our plan to recover our economy and get people back to work. I'd ask people coming to the state and returning to the state for their patience today and over the next few days.
South Australia has recorded 2 new infections of coronavirus overnight, but authorities say they're not worried. The cases involve a woman in her 20s and a man in his 50s who returned from overseas on Tuesday. A cluster in Adelaide's inner west has reached 5, forcing over 1,000 people to self-isolate as a result. South Australia now has 10 active cases.
We are very, very impressed with the way that people are going to have their COVID-19 test when they develop symptoms. This is absolutely vital. We also are delighted with the compliance checks which are being done on people who are required to be in isolation. We have the highest in the country, probably one of the highest in the world, and we're very, very grateful for that.
The further relaxation of coronavirus restrictions in Western Australia has been delayed, again due to the outbreak in Victoria. Phase 5 had been due to begin on August the 15th and would have seen remaining restrictions removed except WA's hard border and access to remote Aboriginal communities. WA had no new cases of COVID-19 overnight, with 6 active cases, all in hotel quarantine.
I know this may cause some frustration for some sections of the community and the business community, but we need to be extra cautious here. The nation is on high alert right now. We cannot afford to let our guard down and take unnecessary risks. As a nation, we have entered the most dangerous phase of this pandemic. Even though WA has not had a community case of COVID-19 since April 11, we need to remain on high alert, given what is happening across the country.
Dr Omar Khorshid is the new president of the Australian Medical Association, and he joins me this afternoon. Dr Khorshid, welcome.
Good afternoon, Patricia.
You're joining the program from WA, where easing of restrictions have been delayed due to the Victorian outbreak. Do you think that's the right decision?
It is the right decision, and in fact there's an argument supported by the AMA that perhaps we need to be a little more restricted here in WA than we are at the moment. We don't have any community spread, and that's fantastic, but it only takes one case, as we've seen with the horrific situation in Victoria, for everything to get out of control. And of course, if we're not social distancing, that one person, as we're seeing in New South Wales, people can really get around and go to many venues. And if you've got huge numbers of people in one venue, it's an almost impossible task for contact tracers.
We're still hearing that people in Victoria who are supposed to be self-isolating aren't home. What can be done about that? Clearly the police are chasing up these people who weren't home. Obviously that's the kind of, the policing approach is the approach the government's taking, but you don't want them to be doing it in the first place. How should the issue be approached?
Look, I think that really the best thing we can do is act together as a community. That means family members and friends of people who are supposed to be isolating actually saying, why aren't you home? Yes, we do need penalties. Yes, we need police to check. But at the end of the day, if Victorians can do the right thing, then we can get out of this crisis relatively quickly with the minimum amount of economic disruption and the minimum number of Victorians getting extremely sick or dying.
What's your sense of how the rollout of this stage 4 lockdown in Victoria has gone? Because it clearly was announced on Sunday. There's been some confusion around business and the implementation of that shutdown. Do you think it's been managed well?
I think the kind of lockdown that has been proposed and implemented by the Victorian government is extreme, and it's very difficult to implement. So they're doing the best they can, and I think I'm very happy with the way that the majority of the Victorian population have responded, recognising that this is a real public health emergency, and by doing the right thing, not only can they reduce the spread of the virus within the community, but actually you can protect your hospital system and make sure that it is there and ready to look after you if you need medical care, either during this pandemic or into the future.
What do you make of the way that contact tracing is working in Victoria? Do you feel like state health authorities have got a handle on the contact tracing process?
What we heard early on from Victoria was that the capacity for contact tracing right at the very start really didn't appear to be there, and the opportunity to really nip this outbreak in the bud was lost. However, that has been realised now. There are ADF members assisting, and from what information we have, they're doing their best. But of course, it's an extremely difficult task to contact trace thousands and thousands of cases. And that's really where the opportunity here has been missed. If it had been done earlier, then it would have been potentially a manageable task and prevented the situation that we're in now.
Scott Morrison says Australia is positioning to supply and manufacture a COVID-19 vaccine. The Prime Minister declared that whoever finds this vaccine must share it. How important is that? And do you feel like Australia is rightly positioning itself? I know Labor's criticised the government that it's not doing enough in this space. Is the government doing enough work here?
From what I've seen, the government are doing enough work here, and there are many groups around the world who are now very well funded, doing fantastic research in both developing these vaccines and now testing them in clinical trials on people as we speak. It is important, though, that as a world community that we act together and we don't end up with a situation where only the richest countries have access to the vaccine and that those countries in most need end up missing out. So I think the government's really on the right track. They're going to act responsibly. They will act to protect Australians, but I think they'll also recognise that we are world citizens, and if we can tackle this virus as a whole world community, we're going to win that fight.
A lot of the focus, of course, has been on Victoria, and that makes sense. The outbreak is biggest in Victoria. But do you think other states like New South Wales need to go further on their health recommendations and restrictions?
I do think other states need to take this virus more seriously. In the case of New South Wales, the AMA today has called for more New South Wales people to wear masks, to wear them at all times indoors with other people, where you can't be appropriately socially distanced, which in reality is pretty much all indoor locations, and also to consider further restrictions on social gatherings. New South Wales is sitting right on the edge of a precipice and could easily end up in the same situation as Victoria. Having said that, though, I think the Victorian government has done a very good job in working hard to track every case. But as you just heard in your story there, people really do move quickly around the community and have contact with hundreds of other people, and that contact tracing job is very difficult.
I just want to talk to you about the impact this is having on healthcare workers. We've got new figures today that number has climbed. The number of healthcare workers contracted the virus. Does that figure worry you, and is enough being done to protect these frontline workers?
The figure is very concerning. We heard today 139 new healthcare workers being diagnosed overnight with the virus. Very concerning, and not just because we're going to lose those 139 people from the workforce, but also they'll have had contact with other health workers, and the impact on the aged care sector, the primary care sector and our hospitals will be amplified by the need to isolate others. It is really important that governments take the need to protect healthcare workers seriously, and the Victorian government has now done that, but the rest of the country need to step up. The AMA has been very disappointed with the reluctance of our state chief health officers to provide adequate personal protection equipment, and by this I mean the N95 mask, which actually protect the wearer from COVID-19, as opposed to surgical masks which do not. We're very disappointed those have not been provided to doctors, nurses and other healthcare workers looking after COVID-positive patients, and this is something that needs to change immediately.
What are your members telling you about how they're coping in the last week under stage 4 restrictions, specifically in Victoria? Things have changed a lot. What are their interactions like with their patients? Has their work become harder in the last week?
We've only had limited information so far, and I'm in my first week of the job, so I've had a pretty crazy time. But certainly the availability of telehealth means that it is possible for Victorians to still access their general practitioner and their other specialist doctors. And I would certainly encourage all Victorians to remember their own healthcare and to keep in contact with their normal doctor so that they can stay healthy. One of the unintended side effects of lockdown is that people don't access normal medical care, and that can lead to physical and mental health harms that could affect the individual well into the future. I think the members are also stressed, but we're doing our best to cope in this very difficult time.
I just want to end actually on the point you just made, that you're new to the job and you're a new face probably for a lot of our viewers, but we'll be speaking to you more and more. But kind of a baptism of fire entering a job like this during a pandemic, just a bit of work to do for you. What do you want to achieve with the role?
Look, I'd really like to make sure that the whole Australian community is very aware that the medical profession are here for them during this crisis, and make sure that our voice is heard in government and everywhere. On the longer term front, I'd really like to help our government and our industry recognise the precarious state of our health system and the need for profound reform to certain aspects of the system. Now, that need was there before COVID, but the financial and social implications of COVID will mean that those big picture reforms are going to be more necessary than ever.
Dr Khorshid, thanks for your time.
Cheers, Patricia.
Dr Omar Khorshid is the new president of the Australian Medical Association. 4 million workers are now being supported by the JobKeeper wage subsidy scheme following Victoria's COVID-19 lockdown. The federal government has today relaxed the eligibility criteria for the scheme to allow more workers to access the subsidy now and when it tapers off later in the year. The changes take the total cost of the scheme to more than $100 billion. Prime Minister Scott Morrison says JobKeeper's proven to be vital for many Australians.
This is the largest program of this nature the country has ever undertaken. It is a scale which is unprecedented, and it stands well in comparison when we look around the world at the various forms of support that have been provided during this crisis. JobKeeper has been a lifeline to people's livelihoods. It's been a lifeline to businesses. It's been a lifeline for the certainty and assurance that it's provided Australians.
Time now for Finance with David Chow. David, hello. How did the market finish up today?
It's finished up slightly weaker, PK. So starting with the Australian dollar, it slipped a bit to 72.1 US cents. So the big picture is the Aussie dollar has risen for 7 weeks against the US greenback. So the big picture is still doing well overall. So the thing that knocked the wind out of the Aussie dollar a little bit is probably the Reserve Bank's revised forecast for the economy, which is considered a downgrade. So the Reserve Bank is now expecting a slower than expected recovery, mainly because of the Victoria lockdowns and its second wave. Victoria, after all, worth a quarter of the Australian economy. So the GDP forecast by the end of this year, the Reserve Bank is expecting GDP to contract by a very steep 6%. But next year, it's expected to grow by 4%, the Australian economy, which is lower than its previous forecast of a 7% growth rate, which is a big come down. Unemployment, now, it's currently at a 22-year high of 7.4%. The RBA expects that to peak to 10% by the end of December, but gradually fall over the next few years, gradually being the key word. So unemployment is unfortunately expected to remain very high for the next few years. And inflation is expected to be around 1% by 2021. So that means interest rates are going to remain at record lows for a long time as well. So these these are based on assumptions, these forecasts, being one, Victoria's lockdown succeeds, and I hope it does, COVID-19 being under control and not spreading to other states, and requiring stricter measures, and the Australian borders reopening in June 2021, which is about 6 months longer than its previous forecasts. So if any of these assumptions change, then so will these forecasts.
That's right. And it looks like tensions between the US and China are flaring up again, with US President Donald Trump signalling a new executive order.
Yeah, that's right, and it seems to have affected the Aussie market and markets in the Asia Pacific. So what happened was that Donald Trump signed a new executive order basically banning American companies from entering transactions with two Chinese companies called Tencent and ByteDance. Now, they're better known for their apps WeChat and TikTok. So the ban will take place in 45 days. Mr. Trump considers them to be national security risks, saying that they're used to spread misinformation, these apps, and spy on US citizens. Both companies deny this, of course. The interesting thing about the text of the executive order, Mr. Trump says that TikTok is already banned on US federal government workers' phones. So I thought, why would you install TikTok on your work phone? That's beyond me, since it's an app that's used to show off your dance moves and lip sync to music videos. So I couldn't figure that one out. But China will most likely threaten retaliation over this rise in tensions between the two nations. And also the background. Earlier this week, Microsoft said it's in serious talks to buy TikTok's US operations, and Mr. Trump showed he's willing for that to proceed, but a deal needs to be done by mid-September, otherwise he will ban TikTok in America. So overall, the Australian share market down about 37 points on the back of these tensions, down 0.6% to close at 6,005 points. And throughout the week, the Aussie market has risen about 1.3%. So quite a respectable outcome overall.
Absolutely. David, are you on TikTok?
I'm not. Are you, PK?
No, but I want to be, David. I want to be. If you get on, David, I'll get on. I mean,
okay,
I probably should be banned. I probably won't go on. It's okay. I'm not going on. David, see ya. The Victorian government has announced Year 12 students in the state who've been affected by the pandemic will be individually assessed for their 8R rankings. The government has also pledged a further $28.5 million for mental health and wellbeing support in schools, saying they had seen higher absence rates from vulnerable kids and a sharp increase in mental health reports in government schools. Deputy Premier James Merlino says no Victorian Year 12 student will be disadvantaged when they take their final exams, and any impacts from COVID-19 in their lives will be taken into account in their final ranking.
We're looking at a number of things. So it may be for students that have been quite severely impacted by COVID-19, whether they've contracted the virus themselves, a family member has, they've been a student at a school that has been closed for a protracted period of time, or it might be a student that has suffered a lot in terms of their own mental health, in terms of family responsibility. So the impact will vary, and that's why it's so important that we have that individual assessment at the school level for that student. So I can't tell you how many students across Victoria will be impacted, but every single student will be assessed, and teachers will be asked, where do you rank them now, and where would you have ranked them if it wasn't for COVID-19, and why? And then we'll look at that data right across the state and make those adjustments.
Professor Sandra Milligan is the Director and Enterprise Professor at the Assessment Research Centre at the Melbourne Graduate School of Education. She joins me now for some analysis. Professor Milligan, welcome.
Thank you, Patricia.
Big announcement made about the way forward for Year 12 entrance marks by the Victorian government. Is it the best way forward?
I think given that we have the 8R and the VCE examinations, it's the best thing to do. I think it really puts an underpinning of a level playing field underneath all the different things that could possibly happen to students this year. So I think it's terrific.
What's your analysis on how it will work? It's individual. So how does that actually, you know, if a Year 12 student is watching, and I know some are, they're all at home now, what will they have to do if they've gone through periods of depression throughout the lockdown and it's affected their studies?
Well, the key to all of this is working with their teacher, because their teachers know them, their teachers are used to assessing them, their teachers know what they can do. And this system that the authorities have put into place is actually a well tried and true system, because even in a non-COVID year, very many students have things that happen to them. You know, people die, there are accidents, they get sick. Just an amazing life happens to them during their final year. So the authorities have already got a tried and true system that takes into account the individual things that have happened to each student if something happens to them, and has a way of figuring out how to sort of compensate for that. Now, the thing with COVID is it's really affected different students differently. So this individual assessment system is a perfect way for everyone to figure out what should happen. It's strong because it's built on teacher judgment. It's strong because it's been built up on precedent over a large number of years, so everyone sort of knows how it works. And it's based on what students have done to date in their work, which the teachers know. So I think it does provide a much better approach than a mayhem that would happen if nothing was happened, or if the ATAR was abandoned at this late date, or VCE examinations were abandoned. I think it's a solid response to a terrible situation.
Oh, look, no doubt it's terrible, but I suppose it begs the question. There's no doubt that there's different effects. I'll give an example. If you're in probably the towers that were locked down, where you were not allowed to leave, I imagine your experience would be different to somebody in sort of a very privileged, larger home somewhere else. They're really obvious examples. But every student, no doubt, has been affected by these shutdowns in Melbourne and the uncertainty around them. So in some ways, isn't everyone going to be eligible?
Not really, because we know from the experience over the last couple of months that the differences are very different. Some people have thrived in this, believe it or not, and many people have been traumatised, and for others it's a bit of a bother. So untangling all of that is very difficult. And the best way to do that, I think it's been judged, is that the teachers can use the evidence that they've had of how the student has been performing over the last 18 months, really, not just this year, but use an on-balance judgment of where they thought the student would be and that can be compared to where they end up, and an adjustment be made based on a balanced judgment. Now, I don't think anyone thinks that this is going to completely fix the whole coronavirus thing. This is a challenge for our system, but I think it does provide a really good, tried and true level playing field that students really can depend on, I think, and stop worrying about whether they're going to be more disadvantaged or less disadvantaged than anyone else. Unfortunately, our system does generate a ranking, so that the important thing is that everyone is on a level playing field, so that those ranks are as accurate as they can possibly be. A lot of people don't defend that ranking system, but we've got it, and the thing to do is make it work as best as it can.
Just briefly, because we're nearly out of time, what's your message to Year 12 students in Melbourne, in Victoria, that are in this situation?
Work with your teacher, but also just focus on doing the very best that you can. I think students can trust that this new approach that's been announced today will make the playing field a lot more level, and all they need to do is concentrate on their work, do as best as they can, talk to their teachers, and recognise that it'll be all okay if they just keep their nerve, I think.
Yeah, that's the hard bit though. I hope they can.
Yeah.
Thank you so much for joining us.
Okay, thanks, Patricia.
Professor Sandra Milligan is the Director and Enterprise Professor at the Assessment Research Centre at the Melbourne Graduate School of Education, talking to us there about the changes that were today announced by the Victorian Government in relation to Year 12 students in Victoria who are now in their second period of lockdown. Of course, they had the first one, which we all went through nationally, but a second phase. And of course, there's been a lot of concern from those students about how it'll impact their ability to enter the next phase of education or work or jobs or training. That's been clarified today by the state government. It's time now for my Friday briefing panel. Stay with us here on ABC News. Hello and welcome to Friday Briefing. I'm Patricia Karvelas. Coming up, this week Victoria recorded its highest coronavirus cases as the state entered stage 4 restrictions. As a result of this, the federal government has relaxed the eligibility criteria for the JobKeeper payment, with the cost of the virus hitting harder than first estimated. My panel today, emergency physician and former AMA Vice President Stephen Parnas, IncoLink CEO and former Victorian ALP Secretary Eric Locke, and the West Australian's Jenna Clark. Welcome to all of you and let's get into it. Scott Morrison says the Andrews government is solely responsible for restrictions in Victoria amid restrictions and criticism of the state government's handling of the pandemic. The Prime Minister's had some comments today in relation to that. I want to go straight to you, Eric Locke, about that, because that issue around the handling of these restrictions on the reduction of the workforce has been a huge issue this week. I know that you've been working with the construction sector. Has it been handled well?
Well, Patricia, something changed along the way this week. I will say at the outset that we've worked in partnership with the state government for some time to do on-site COVID testing. We've done 15,500 tests and we've had 7 positives. There's been minimal disruption to the work as a result of those positives, and people have been able to go back to work. So there's no evidence that the construction industry was a major problem, and the government seems to have adopted this policy purely on a traffic of employment basis, people going to and from work rather than it being a construction-specific problem. The 25% rule that they've applied to construction is kind of unworkable, to be honest. That on large commercial sites, that'll mean that we're not really keeping the pilot light on like they say, but they're really using a candle snuffer to the industry. And research we had conducted by Azel Allen shows that this is going to have a massive impact of up to $25 billion, 166,000 jobs. It is devastating.
Look, there's no doubt it's devastating, but if you ask other workers in the economy that have been shut down in the first lockdown, construction had been spared. It's now joining because obviously the crisis is at a point where more industries had to be shut down, including abattoir reductions of workers as well, Eric Locke. So is it necessary? It might be devastating for the economy and for this sector, there's no doubt about it, but is it necessary?
I'd like policy making in this space to be evidence-based and ideology-free. So I think if you use evidence as it applies to construction, and the evidence I've just given you is pretty compelling, there was no real need to shut it down to the extent that it has now. Certainly there was dialogue with the government up throughout the week and something changed at the last minute. So look, I'm going out with someone who works in the arts sector, and you've talked about this as well. That they have felt this devastation more than anybody. So we're not alone, but you do need some economic vitality to keep the fires at the dimmest level in Victoria. But I fear they're very much out. And in construction, it's very difficult to restart them because it's a well-developed ecosystem over many years here.
Stephen Parnas, I want to bring you in because that perspective from Eric Locke, I'm guessing, I don't know till you speak, might be a bit different to yours. What do you think of the way this has been handled? Clearly the state government in Victoria has made the call that it needs to go to a higher level of restriction to try to beat this virus. Do you think it's been handled well?
I think it's been handled as well as could be expected. I'm not expecting perfection. When we think about trying to cut down the level of human interaction across an entire state, inevitably there will be errors of omission and commission. But lives are on the line. The stakes could not be higher. And I think we've learned around the world that when you're talking about economic productivity, it's always going to be severely handicapped if you are fighting to save lives of a big proportion of the community.
Is enough being done to protect healthcare workers?
No. The reason I say that is because the numbers worried me today as much as the absolute number a week ago. About a week ago, we were talking about 1,000 healthcare workers being active cases. Now we're talking about in excess of 1,500. I don't want to be critical of the work that everyone is doing, from political leaders, Department of Health officials, hospital executives. But the fact is that the response around the system is patchy. I think that we are retrofitting the healthcare system. To give you an example, I do not have guaranteed places to change in and out of scrubs when I start and finish a shift. These are examples replicated around the system, and I think while there is a lot happening, there is still a hell of a lot that can be done to try and reduce the rate of infection.
I want to still stick with you if I can, just on, as you say, this is as good as it can be, but we were waiting for stage 4 to be announced, and it was over the weekend, and since it's been the rollout with lots of detail coming out about non-compliance as well. Why did we have to wait so long for stage 4? I mean, if the government was coming to the view, Steve Parnas, that ultimately this strategy that they were going through with stage 3 was going to, reduce the number of infections, but it would take 6 months, did they take too long to go to the next phase? Because we just have to wait for longer, ultimately. That's the issue now. You just have to wait for longer every time you delay the next move.
Yeah, I think we're all on an incredibly rapid learning curve here, Patricia. The fact is that everyone's wise in hindsight. The trend over the 6 months, as I have observed it, is that we have become more and more aggressive in our control measures, whether that's the provision of PPE all the way through to levels of lockdown. What's clear to me now is that the level 3 restrictions we had did make a difference. I think it is the difference between real difficulties and catastrophe. Now, the fact is that we can't change the past. I've been saying for ages now that really I think a lot of my colleagues aren't interested and haven't got the time, to be honest, to go back and say, should we have done something differently 2, 3, 4 weeks ago? What we need to do now, in a wartime situation, essentially, is say, what do we do from today and what do we do for the weeks ahead? And I think the priorities are clear. Get this infection rate down with the only tool we've got. Support the people across the entire community who have a role. It's not just health workers, clearly. And let's work to that common goal. And also, I think, to see what we can learn along the way. I think acknowledging that we don't do things perfectly from the beginning is the healthiest way to do this.
Yeah, look, Jenna, you're coming to us from a place that looks like a utopia to me, and that's Western Australia, where, you're hanging around with no new coronavirus cases. Is there a sense, I'd love to get a sense from you, is there a sense of looking over the country and thinking, God, we're glad we're not there? What's the kind of collective mood in WA?
Yeah, PK, I think the collective mood in WA was for the past couple of weeks, look at how bad the East Coast have stuffed up their response to coronavirus. But now I think the community vibe, looking over east across the Nullarbor to all you guys over there, is one of absolute horror. And I know that thoughts and prayers go out to all of you guys over there dealing with that. So I think we're looking over there just kind of going, this could be us in the next couple of weeks. We've had the president of the AMA, Andrew Miller, come out today and say, look, COVID is a terrorist and it's probably going to take hold in WA again. and so he's calling for us all to be very vigilant. There is a lot of non-compliance in WA at the moment. A lot of people are like, COVID, what's that? Don't even know what that is anymore, because we've been without community transmission for about 5 weeks now. So I think we've got pretty complacent over here, but I think it's lurking beneath the surface of our psyche that it could actually take hold once again.
And how has that played into the feeling in WA around that hard border? Because we're going to get to the border a bit more and the way it's been handled, the federal-state kind of stoush, which is now not a stoush sort of... Anyway, we'll get into it. But what's the mood about the way it's been handled? Is there a really strong support for that hard border?
Yeah, absolutely. All of the type of anecdotal surveying that we've done at the West and other places has said 96% of all people that have responded have said keep that hard border up. It's the one thing and the only thing that's protecting Western Australia from COVID-19. And that's why I think a lot of people have really relaxed and been able to go about their lives as they would previously to this epidemic, taking hold around the world. And I think if the hard border wasn't in place, a lot of people would be a lot more terrified of what was to come. We've seen WA Premier Mark McGowan come out today and he's pushed back our Phase 5 restrictions for another 2 weeks. So we're not going to see them until late August, which means that we're going to remove the sort of the 2 metre rule between people. And also he's again doubled down on the fact that that hard border will remain in place. A lot of people even around the traps are saying it could be up until Christmas. So I don't think a lot of West Australians want to see it come down, and that's why we probably feel a little bit more chilled out than usual about COVID.
Yeah, chilled out. What a way to be. Eric Locke, not chilled out in Melbourne. Not a chilled place. I think it's fair to describe it as unchilled. You'd agree with that assessment?
Well, it certainly feels pretty bleak here. It's also about 9 degrees. So, it feels chill in its own way. What a sensational job the West Australian government has done over there, though, and it's one time when isolation really has been a benefit. And you'll see, the porous nature of the New South Wales and Victoria borders are a real problem for us, whereas WA doesn't suffer from that. And can I also just take this opportunity off point to say what a sensational job the West Australian newspaper has done on Indigenous issues recently while I'm here. But yeah, it feels very difficult here, and it feels like we've been in lockdown for a long time with a long way to go, with very little happening outside the front door.
Look, I want to go to Jenna on that because you've raised it. I've noticed too, Jenna, that the West Australian has really started campaigning very strongly on issues around Indigenous affairs, and some really powerful reporting and also some great hiring that's gone on too. What's going on?
Well, I think we're just sort of listening to the call. WA has some of the most amazing Indigenous communities in the world, and that's why we just wanted to highlight not only the fantastic things that they do. I think their COVID response has been amazing, and that has been one highlight, the fact that if you let a community-led response take charge, this is the success that can happen. So congratulations to all those community leaders up in the Pilbara and up north and down south that are leading the charge with that. And also the fact that we have, a terrible amount of discrepancy between the haves and have-nots in WA, and I think we need to really highlight the fact that we have Indigenous incarceration rates are through the roof, domestic violence and also unemployment and illiteracy within our Indigenous communities is an absolute deplorable epidemic and terrible statistics. So I think we just want to do our bit in the fact that we are highlighting those stories and also educating the West Australian public to bring them along on the journey of not only reconciliation but just understanding that this is what fellow West Australians are experiencing, and highlighting, shining a light into corners that are probably haven't had a light in there ever. So I think hiring someone like Annabelle Hennessy is doing some amazing work in the space of specifically around child protection and the removal of children from communities, and the fact that they're falling through the cracks is one way we can focus on things. And I think we've got a long way to go, but I think if we can all come together and do our bit, and also we've been campaigning for changing the date as well back in January as well. Got a little bit of flack from that around the country, but we're sticking to our guns because we just want to make sure that we act as a positive beacon in the world.
Wow. It's amazing. I've watched the change there, and it's incredible to watch. Stephen Parnas, I will bring you in on that theme, and then I want to ask you another question just on the way COVID's been handled for Indigenous communities, which I think is our success story so far. We don't feel fully successful around COVID, but that is one of the successful stories, isn't it?
I couldn't agree more. I've been talking to friends and colleagues in the Northern Territory, for example, and the care that's being taken by everyone up there to keep the virus out of those remote communities is really inspiring. This virus takes no prisoners when it comes to exploiting the weak and the vulnerable, and there's no doubt that when it comes to health outcomes, our Indigenous people are among the most vulnerable that we have. So that's something that I think we can be proud of, but absolutely remain vigilant about as well.
Something we can't be proud of, I mean, we have a moment of pride, but let's be honest, is the handling of the aged care situation and the outbreak we're seeing in Victoria. Stephen Parnas, shouldn't we have seen that coming? It was happening overseas. We had the example in Sydney with the outbreak there. We know this is vulnerable. We now have these awful reports coming out about delays in notifying the department and managing the COVID-19 situation. Who's to blame here?
I don't like the question, Patricia.
Oh, well, what question would you prefer?
No, but I will answer it. I think the system is to blame. I think for over 20 years we have had an aged care system where the incentive is about how lean we can run the system, how we can remove resources. And I, for one, don't think you can run an aged care system and run a significant profit. The most expensive cost in aged care is staffing, and unsurprisingly, we have fewer staff than we should in aged care. We have less trained people such as nurses than we should have. And it's difficult for doctors to access the aged care system with basic infrastructure. So I'm not surprised, but again, my strong sense is here and now, federal and state government cooperation to deal with some of the horror stories that are coming out at the moment. They really, they just make my stomach turn when I hear them from my colleagues who are in there on a daily basis. But let's do that. But then let's not forget, once we get past this tragedy, and listen to what the current Royal Commission is saying at the umpteen reports that have been commissioned and quietly put into a drawer over the last 15 years. And let's make changes to the aged care system along the lines of what we've seen with things like the NDIS, because the way we treat our frail and aged is really the ultimate measure of our decency as a society, I think.
I just want to change the topic to that inquiry into what went wrong in Victoria's hotel quarantine program. It's been delayed due to the state's stage 4 coronavirus restrictions on workplaces. But former Family Court Judge Jennifer Coate, who's heading that inquiry, says there's no legal reason preventing government ministers from answering questions publicly about that issue.
This Board of Inquiry is not a court. Under law, unlike a court, there is no general restriction or prohibition which would prevent a person from commenting publicly or answering questions to which they know the answers on matters which are the subject of examination by this Board of Inquiry.
Eric, look, I want to start with you on this because there was a lot of criticism on social media of journalists who asked hard questions of the Premier, Daniel Andrews, over the last couple of days, but particularly yesterday in relation to hotel quarantining. Look, I've got to put my hand up, full declaration. I think journalists should be allowed to ask robust questions of all governments, of all premiers, whatever their political colour is, but not everyone has been satisfied with that approach. Premier does take all the questions. There's no doubt about it. He takes all the questions, but he doesn't really answer all of the questions around hotel quarantining. He says that this inquiry needs to happen and that will deal with the details. But clearly we just heard there that there's nothing to stop ministers or the Premier answering questions. Should the state government be a bit more forthcoming about answering some of these questions?
I'd make the following observations. I don't know the details of what went on there, obviously, and I don't know what went to Cabinet. But November's a long time away. I think they've set that as the reporting time. So we will put up with this dialogue for a very long time through these restrictions unless something is said in the meantime. I think once we're the other side of these restrictions, and hopefully case numbers start coming down, we all feel a bit better and we can put this behind us. That would be the ideal time for the government to start talking about this. I think to some extent, there's no point talking about it now, because what we're dealing with now is trying to get case numbers down. Let's not deal with what went wrong. Let's deal with what we can do right now, and that's changing human behaviour so that we don't make mistakes, because I don't think anybody could legitimately claim that the Premier had visibility to what security guards were doing. But there does come a point where we need to move past that. And I hope that's sooner than November.
Sooner than November would be good. Dr. Parnas, what do you think? You actually kind of made a mention of it before, saying we haven't got time as doctors to be worrying about this. But there is a question around accountability on these issues, how we got to this state. I think ordinary Melburnians are even saying, hang on a minute, why aren't we WA? Why aren't we? You know, there are normal questions being asked as we are in our second lockdown. Are these reasonable questions to ask?
I think the questions are absolutely reasonable. The question is the timing, I think. When I'm in a resuscitation bay, I haven't got time to check the literature or ask other people's opinions when I'm trying to save someone's life. Afterwards, there is absolutely time for reflection, for open disclosure, and for constructive discussion about how we could do things better. I think at a societal level, yes, these questions have to be asked because we want to avoid doing the same thing again if there are mistakes. But what and I think, again, people in the health professions want is a Premier, a Minister for Health, a state government and a bureaucracy focused on what they can do to support us and what they can do to educate and encourage and support the community who are going through incredibly painful times at the moment. The question is, when do we probe for those questions and look for those answers? You know, my sense of yesterday's press conference with the Premier was that too much time was spent on it, and I think he had to answer the same question about a dozen times. Now, to me, I thought, let's focus on the things that are going to save lives, get us out of lockdown in the short term. But you know, when the numbers start settling down and we all take a sigh and collect ourselves, then I think that's the time when focus can really turn to what was done wrong and how can it be done better.
Yeah, OK. So you think it's an issue about timing and emphasis. Fair enough. Jenna, I know you're in WA and, you know, you're not watching this probably to the extent that people in Victoria or in the south are, but what do you think of this? There's a fine balance, isn't there, when there's a health emergency to dealing with the emergency itself and also wanting to get to some conclusions about how it even happened?
Yeah, definitely. And I think the bedrock of any good democracy is a free and able press. And I think what some of the journos were doing yesterday with Mr Andrews, look, I think kudos to the Premier for, I think his press conferences are stretching into almost the 2-hour mark. So it's a gruelling task just facing a press pack that's hungry for information and wanting to disseminate that as quickly as possible to the viewers and their readers and things like that. But I think whilst I think you need to take the temperature of what the general public want, I think they just probably want health information, and also maybe it is just the relationship of the fact that Dan Andrews, he did come out and he was at first he was very negative towards how some people were acting in the Victorian community around some people weren't playing fair and weren't abiding by the rules, whereas I think for a WA point of view and just watching the difference between the way that Andrews has responded to this crisis as someone like Mark McGowan, his messaging has been consistent, it's been positive, it's been inclusive, he's brought everyone along and always thanked, you know, the healthcare workers and the West Australian public for doing a really good job. And I don't think we've seen that from Andrew. So I can understand why some people are a little bit jarred at the fact that his messaging is maybe a little bit off sometimes and he doesn't want to answer some questions. Probably not because it's sticky, but the fact that it probably hasn't even landed on his desk yet because he's just trying to focus on those infection rates. It's probably just still at the agency level of the public service. So time and place, I guess, but kudos to all those journos that are working equally as hard as all the government ministers just trying to get that information to the readers and the viewers.
To be fair to Premier Andrews, he absolutely always acknowledges all of those frontline workers a lot, but I suppose he's also talking all the time because he's got an emergency on his hands. I want to end, if I can ask you, Eric Locke, about the implications. We started with you on this construction industry, the way that the stage 4 lockdown will affect the workforce and industry. But what are the long-term implications? It's meant to be a 6-week lockdown, but do you think this could cause the state really serious economic damage in the longer term?
Yeah, well, look, there are a number of industries that take a long time to restart, and construction is one of them, obviously. Manufacturing, health industries all take a long time to restart, and they're kind of the bedrock of the Victorian economy. And if we just go to coronavirus more broadly, PK, the thing that has been driving the Victorian economy for many years has been kind of the immigration being the chosen place to live, and Victorian exceptionalism, which has gone on for 20 or 30 years. And the real concern, I suppose, is this might end that. Certainly population growth is out of the way, but whether this has a long-lasting trail on the Victorian economy is yet to be seen. Certainly I'd love to see the government do some really adventurous things now on social housing. We've seen what can happen in these towers that are just near me and near many Victorian residents. I'd like to see them do something about that and do something simultaneously about the economy, our social fabric, and also one of some of the most pressing social issues we've got in this state. So it remains to be seen. It's in the government's hands, not only how they fix this problem now, but how they respond going forward. And that'll be the true test of whether they have nailed this.
I just want to get your thoughts too, because the federal government has pivoted on JobKeeper as well, so that making it easier essentially for Victorian businesses to get it, but it's a national scheme. Was that the right decision?
Yeah, absolutely. So I was really pleased to see that. The only observation I'd make is I welcome the changes in timing that will really suit Victorian industry, and it'll be a great support for hundreds of thousands of jobs. But the drop in amounts are material, and in construction, $1,200 or so in support of fortnight really doesn't go far to bridging the gap. So it's not going to be quite. It might be the pilot light for wages in construction, but the rest of the restrictions are still the candle snuffer. So we retain a major problem in our industry.
Dr. Stephen Parnas, I want to end the panel discussion today with your thoughts or messages, if you could provide them, for the people in lockdown who probably have seen the figures this week, particularly that day where we were in Victoria over 700 cases and thought, all of this work we're doing, staying home, trying our best, isn't working. Is it working?
Well, I was encouraged when I spoke to a couple of colleagues who are epidemiologists. They don't just look at the number that the Premier mentions each day, they look at the rolling average over a period of days, and their feeling is that the numbers are levelling out. And my strong sense is that with the increased level of restrictions, that it's not long before we start seeing numbers decline. Now, that's important because I think every Victorian is doing it tough at the moment. It's painful, and there are a lot of traumatised people hidden away in homes at the moment. So my very strong sense is that they need to be encouraged, that the messages from everyone inside and outside of Victoria is that they are doing an amazing job. They should be proud of their efforts, and I think the rest of Australia can look and learn from what the people of Victoria are doing at the moment.
I think that's a good way to end this panel. You've all been great panellists. Thank you so much for joining us on the program.
Thank you, PK.
Thanks, PK.
Thank you.
Emergency physician and former AMA Vice President Stephen Parnas joining us there. Also, IncoLink CEO and former Victorian ALP Secretary Eric Locke giving us his views on the economic impact, and the West Australians Jenna Clark talking about the WA experience, which is pretty positive experience at the moment with their hard borders. Well, that's it for Friday Briefing. I'll see you on Monday at 4 p.m. Stay with us here on ABC News.
Our life is better with him in it.
I love you.
You go home and you hope your family doesn't get COVID from you.
I'd still be paying the $9,000 if I hadn't contacted 730.
We really are.